Hello students. Today we are going to discuss regarding the physiology of circulatory shock. Let me introduce first. I'm Dr. ANJALI SHETE, working as an associate professor in the Department of Physiology, Government Medical College, Aurangabad. This is a very common question which is asked in the examination as an LAQ also, and it's a very favorite question for MCQs plus the Viva question. Now, under these heading, we are going to discuss this particular topic. First, we are going to see how it is defined, what are the different causes, what different types of shocks you see, how the shock is progressing, what are the different stages of each shock. In detail, we are going to see regarding the hypovolemic shock, what important other types of shocks are there, and what will be the physiological basis of treatment of shock. So, under these headings, we are going to discuss this particular topic today. The first, we are going to see the definition. As such, it is defined as a condition where generalized inadequate blood flow throughout the body is seen, which is unable to meet the metabolic demands. So there is a generalized inadequate blood flow is there, and which is unable to meet the metabolic demands. And due to that, the condition of shock is appeared in that particular person. Now, what are the causes of each shock? If you see, very commonly, there is a decreased cardiac output, and due to the decreased cardiac output, you get this circulatory type of shock. So this is the first and very much important point for the cause to occur in any person. Shock to occur. Now, any condition which decreases the cardiac output can lead to shock. So whatever the conditions which are causing the decrease in the cardiac output, the first and the most important condition is cardiogenic itself. The heart itself can have many types of cardiac abnormalities which can decrease the pumping ability of the heart. And due to decreasing the pumping ability of the heart, the cardiac output will reduce. And these conditions like myocardial infarction, heart valve abnormalities, heart arrhythmias, these are the common conditions which can lead to decrease in the pumping ability of the heart. That decreases the cardiac output. Sometimes there is a decrease in the venous rhythm also. And that venous rhythm, as it is responsible for maintaining the normal cardiac output, if any decrease in the venous rhythm will cause the decrease in the cardiac output leading to shock condition. The decrease in the cardiac output due to the decrease in venous rhythm generally occurs whenever there is diminished blood volume. So there is loss of blood flow or blood volume is there. Then sometimes the vascular tone itself is decreased, or many a times there is obstruction in the blood flow. So these are the common conditions where you get the decrease in the venous rhythm. But many a times it is seen that the cardiac output is normal, still the person is in a state of shock. Why? Because there is maybe excessive metabolic demands are there. So the output is normal, but the demands are there. Or sometimes the output is normal, but there is abnormal tissue perfusion. So in all these conditions, shock can occur. So these are the common causes of shock. Depending on these common causes, the shock conditions are classified into different types. The first and the most common is hypovolemic. So whenever the volume of the blood is less, then this term as hypovolemic. You have septic type of shock. So whenever there is a widespread infection, which leads to decrease in the cardiac output and decrease in the arterial blood pressure, is termed as septic shock. Cardiogenic type of shock. Then you have anaphylactic type of shock, in which the allergic reactions they will produce the shock-like condition. Neurogenic, whenever there is tone of the vascular vessels throughout the body is diminished. Then you can have obstruction to the blood flow. So depending on the causes, you can have these types of shocks: hypovolemic, septic, cardiogenic, anaphylactic, neurogenic, and obstructive. Now, maybe any type of shock is there, but the shock is always progressed into three stages. And these three stages will be common for any type of shock. So the first stage, which is there, is non-progressive stage, which is also known as compensatory type of stage or compensatory type of shock. The normal compensatory mechanism in this particular stage, they are coming into play. So the person whenever is in a stage of shock, all these negative feedback mechanisms, which are the compensatory mechanisms of the body, they come into play and they will try to have the full recovery without the help of outside therapy. And this particular stage is known as non-progressive stage, the first stage. The second stage is without the therapy, the shock becomes steadily worse until death. What happens is whatever negative feedback mechanism they were coming into action. But if after some time without therapy they are failing, then they will shift to negative to positive feedback mechanism. And due to the positive feedback mechanism, the stage of the shock will become worse until death occurs. And finally, the third stage, which is irreversible stage, here, whatever type of therapy you are giving, still the shock has progressed to such an extent that no therapy will be inadequate to save the patient's life. So, any type of shock will have these three stages. The first is non-progressive stage. Here, all the body feedback mechanisms, which are protective negative feedback mechanism, they will try to save the body and try to maintain the normal cardiac output and the normal blood pressure. The second, progressive. Here, the negative feedback mechanisms will fail and the positive feedback mechanism will come into play. And then the shock will progress to the further stage, worse. And finally, it can land up into irreversible stage. Now, all these stages we are going to see in one particular type of shock, which is hypovolemic shock. So many a times the question is asked related to these hypovolemic shock, that describe the stages, compensatory stage in hypovolemic shock, like that. So you can explain in this particular type. So hypovolemic shock very commonly it is a picture which is very evident that you get trauma accident, you get the loss of blood volume that increases the cardiac output. So this is due to diminished blood volume. In this, the circulatory field pressure decreases, which decreases the venous rhythm and hence decreasing the cardiac output as well, and the person lands up into hypovolemic shock. The most common causes of hypovolemia are both non-hemorrhagic as well as hemorrhagic. Non-hemorrhagic are severe cases of vomiting, severe cases of diarrhea, when there is bowel obstruction or inflammation of pancreatitis, in cases of burns, or sometimes neglect is there, environmental dehydration is there. So these are the causes which are non-hemorrhagic. So no hemorrhage is there, but still there is diminished blood volume, mostly due to loss of plasma volume. Whereas most commonly hemorrhagic types are seen, that is, in cases of GI bleeding, in cases of trauma accidents, in cases of hemoptysis, that is vomiting of blood, ectopic pregnancies, the pregnancy outside the uterus, and postpartum bleeding. So these are the conditions where you get excessive hemorrhage, and due to that, there will be diminished blood volume. So this is hypovolemic shock. Now how this hypovolemic shock is going to progress in these three stages. First, we are going to see the non-progressive stage. As we have discussed in earlier slides, that this is the stage where all the body mechanisms will try to maintain the cardiac output and blood pressure at a normal level. So if they were decreased, now the body will try to bring back it to normal level. And for these, the negative feedback mechanisms which are there as a protective mechanism will come into play. So we will see what are these. The first and the most important is baroreceptor reflex. So what happens is immediately whenever the blood pressure is low, the baroreceptor reflexes will be activated and they will cause the sympathetic stimulation and try to bring back the blood pressure towards normal level. If the blood pressure is below 15 meters, then the CNS ischemic response will cause the further sympathetic stimulation. And both of these two are causing the vasoconstriction. And due to vasoconstriction, the blood pressure will be trying to reach at the normal level. Now remember that whenever there is vasoconstriction, Apart from cerebral vessels and coronary vessels, all other remaining vessels will show vasoconstriction. So these two vessels will be spared. So they will get the normal type of blood supply, or the constriction and dilatation will not be evident in this particular field. So they will be activated to maintain the normal pressure. Then comes the reverse stress relaxation. So what is this mechanism? Is that whenever you have suppose a area is there, and then you have the diminished blood volume, a particular area is there. In this particular area, the circulatory system will be activating with this reverse stress relaxation. And due to that, there will be contraction of the blood vessels. And due to this contraction of the blood vessel, that particular part which is having diminished blood volume will be getting more amount of blood volume. So this is one mechanism to protect the tissue damage. Then comes the role of kidneys. The kidneys will secrete renin, which will produce the angiotensin too. And that further increases the vasoconstriction. And the posterior pituitary also increases the secretion of vasopressin, leading to more vasoconstriction. Epinephrine and norepinephrine from the adrenal medulla will be again released to cause the vasoconstriction. They also will increase the heart rate. So, in a patient of shock, you always get tachycardia. So, these are the things which you have to notice. So, these are the protective mechanisms. So, if you consider all the previous things, all the mechanisms which are negative feedback mechanisms, they are going to try to maintain the arterial blood pressures at a particular normal level, but very less or some time is required for the maintenance of the cardiac output. How the cardiac output is will be maintained by at a normal level is trying to bring back the blood volume towards normal. So what are the compensatory mechanisms? Now these will take some time. What they will cause? They will cause absorption of large amount of fluid from the GIT, absorption of fluid in the capillaries from interstitial spaces, water and salt conservation by kidneys, and increased thirst and increased salt intake. So if you concentrate on these four mechanisms, all these four mechanisms will try to bring back the normal blood volume towards a stage which is a normal level. And then by these mechanisms, you can maintain the cardiac output. So if you see, there is a vasoconstriction to maintain the normal cardiac output, and then you have the compensatory mechanisms to have a normal cardiac output. To summarize, within fraction of seconds, you get the activation of sympathetic reflexes plus the capital hormone release, and that helps in rapid recovery to maintain the arterial blood pressure. Then in next 1 hour, angiotensin, vasopressin, and reverse stress relaxation, they will come into play and they will cause the contraction of blood vessels plus the venous desires, increasing again the arterial blood pressure. And in the next 48 hours, the adjustment of the blood volume by absorption of fluid by interstitial space and intestinal tract with increased intake of water and salt will take place, will try to maintain the blood volume and thus the cardiac output. So you get these three stages. Immediately the sympathetic reflexes plus the catecholamine. In 1 hour, the angiotensin, vasopressin and reverse stress relaxation, and in next 48 hours, readjustment of blood volume. So this is what happens in the compensatory type of shock condition. So what you have is low blood pressure. If the blood pressure is between 100 and 70, the stimulation of baroreceptors will be there, and that causes the sympathetic discharge. If the blood pressure is between 70 and 50, it also causes the stimulation of peripheral chemoreceptor, again leading to sympathetic discharge. If it is below 50 millimeters of mercury, then baroreceptors, chemoreceptors, and plus the CNS systemic response, all three will be activated and they will lead to sympathetic discharge. Now, what this sympathetic stimulation will cause? It will cause increase in the myocardial contractility, thus increasing the cardiac output. Try to maintain it. Then it can cause vasoconstriction. Due to that, again the cardiac output can be maintained. Then It can cause the vasoconstriction. The vasoconstriction increases the peripheral resistance, decreases the capillary filtration, or decreases the GFR. And by all these three mechanisms, what it is causing increase in the cardiac output and trying to maintain the blood pressure at the normal level. Along with these three mechanisms, it also causes renin release, which releases the angiotensin, and this angiotensin will cause increase in the aldosterone secretion, causing retention of sodium water and maintaining the blood volume. First mechanism, maintaining the blood volume. And then arteriolar vasoconstriction, increasing the peripheral resistance, and thus all these factors coming into play try to maintain the normal arterial pressure plus the normal blood volume. So all these are compensatory mechanisms which come into actions. Now still if the condition is worse, then these negative feedback mechanisms will be converted into positive feedback mechanism and the condition of shock will be further worsening. Now this is a very good figure again from the pattern which shows how the positive feedback mechanism will be converted into an vicious circle. So there is basically decrease in the cardiac output which decreases the arterial pressure that basically decreases the systemic blood flow. If this is decreased, this decreases the cardiac nutrition, this decreases the nutrition of tissues, and that causes also the intravascular clotting. Now, if the nutrition of the tissues is decreased, this is going to cause three conditions. That can decrease the nutrition to brain, which directly decreases the vasomotor activity, causes the vascular dilatation, venous pooling of blood, which is going to cause the decrease in venous return. That again decreases the cardiac output. So there is a first positive feedback. Then it can also affect the nutrition of the vascular system. If it is affected, it can directly cause the vascular dilatation and leading to decrease in venous return. Or it can increase the capillary permeability and cause decrease in the blood volume, thus leading to decrease in the venous return. So these are the two conditions when you get the decrease in the venous return, which again relates to positive feedback causing the decrease in the cardiac output. This also causes tissue ischemia and there will be release of toxin. If the toxin is released, then what it causes? It causes directly cardiac depression and thus directly pumping activity of the heart will be affected, causing decrease in the cardiac output. Or it can cause the release of toxin can cause vascular dilatation and then decrease in the venous return. The intravascular clotting also can decrease the flow, cause the obstruction, and thus decrease in the venous return. So all these mechanisms will come into play and will have a positive feedback mechanism where the condition of the shock gets worse in the play. Apart from that, you get generalized cellular deterioration. What happens is that normally there is active transport of sodium and potassium at the cellular end, but this particular transport mechanism will be diminished and the normal activity, the pump activity, will be lost or will be diminished, resulting in you have the oozing of fluid inside the cells, causing swelling of cells. Then there will be depression of mitochondrial activity. Then you have the lysosomes which are break down more, releasing the hydrolysis, and that will further damage the tissue. So overall, the cellular metabolism is depressed. Now these effects generally damage the tissues. All tissues are damaged, but especially the liver, lungs, and the heart. They are damaged more in these conditions. The metabolic derangements, what they are going to cause is there will be accumulation of waste products, most commonly the lactic acid, and there will be deprival of oxygen. Then shift of metabolism to from aerobic to anaerobic, and all these will lead to acidosis condition. Thus, the positive feedback mechanism leads to a vicious cycle but can sometimes we overcome by negative feedback if it is in a mild case and if you are doing vigorous therapy at this particular condition, so it can come out from the shock condition. Otherwise, this condition is leading to the first stage, which is known as irreversible stage. Now, what happens here? Because even if you are giving the vigorous therapy, it will not reverse the condition and it cannot save the person's life. And this particular condition, why it is seen because the high energy phosphate substances, they are diminished and they are very difficult to replenish. So the body is completely loss of all these things. So if you see, there are three stages of shock. The first is non-progressive, where all the compensatory negative feedback mechanisms will be coming into action. Second is the progressive, where the positive feedback mechanism will worsen the condition of shock. And the third is irreversible stage, where without therapy or even with vigorous therapy, you can't save the person's life. So this is regarding the three stages which are due to which are seen in hypovolemic shock. We have seen regarding the hemorrhages. Now, few points we are going to see regarding hypovolemic shock, which is due to plasma loss. This is seen in cases of intestinal obstruction. It increases the intestinal capillary pressure, causing the fluid to leak and loss of plasma is there. In cases of burns, which is very common, so there is a plasma loss and the person is in shock. Maybe excessive sweating, severe diarrhea, severe vomiting, excessive loss of food by feeding, or sometimes inadequate intake of fluid and electrolytes can lead to dehydration and lead to hypovolemic shock. And in conditions of trauma, you get severe plasma loss also. And all these can lead to hypovolemic shock, but due to less of plasma. Then, one important shock we are going to see is that neurogenic shock. Now, what happens in this neurogenic shock? Normally, there is a normal vasoconstriction, which is known as vasomotor tone inside our body. But this vasomotor tone will be lost, and due to that, there is an increased vascular capacity. So you get an capacity of the vessels will be increased. And this occurs suddenly, and that reduces the immune system pressure, increases the venous return is also decreased, and the cardiac output is also decreased due to the loss of vascular. The most common causes where you get where you see the sudden loss of osmotic is in cases of deep general anesthesia, in cases of spinal anesthesia, or in cases of brain damage. So directly the tone which is maintained by the sympathetic nervous system will be affected in these particular conditions. So you should be very careful regarding giving these particular anesthesia. So very commonly these type of anesthesias will be causing a damage. Say for example, there is a damage at the level of spinal cord, and that can cause sudden loss of motor, and this leads to neurogenic type of shock. One more common type of shock is seen, which is termed as anaphylactic shock. This is due to allergic conditions, and these allergic conditions will cause antigen antibody reaction, releasing histamine or histamine-like substances, and these substances then decreases the cardiac output and blood pressure. That particular condition is termed as anaphylactic shock. These substances they cause the venous dilatation, decreasing the venous return, and they also cause the arteriolar dilatation, decreasing the blood pressure. Their increase in the capillary permeability is seen leading to rapid loss of fluid. And this generally is as it is due to allergic reaction. Most commonly it is seen due to bath syndrome, allergic reactions. Then again a septic shock is very commonly seen. Here what happens is that there is a bacterial infection, but this bacterial infection instead of at a particular point it will be spread widely through the body. And then this widespread infection can lead to inadequacy of the blood flow. The most common causes are whenever there is peritonitis due to infection of uterus or fallopian tubes, peritonitis due to rupture of GIT, generalized body infections such as streptococcal or staphylococcal infection, gangrenous infections, infections of kidney or urinary tract. So if you see that Instead of a localized infection, this bacterial infection will be spread out throughout the body, and this can lead to septic shock. This is a photograph of gangrenous infection, which can lead to septic shock type. There are some special features related to this septic shock. Is that instead of cold and clammy uh, features in these particular conditions, you get high fever, you get vasodilation, there is high cardiac output instead of low cardiac output, very commonly observed. There is sludging of blood, and due to this, there is a disseminated intravascular coagulation. These features, we can again go back and see your text. So these are very important features which can differentiate between other types of shocks. So these are the special features. Suppose a patient comes to you. This patient looks ill. There is altered mental status. The skin is either cold or hot. There are weak or absent pulses. The blood pressure is less than 110 and heart rate is low. Tachycardia is there. If a patient comes to you like this, is this patient in shock? Is the first condition you have to think, yes, these are all signs and symptoms of shock, and immediately you have to start the treatment. Now, what should be the treatment? As we have seen in the first, that there is a decrease in the cardiac output and decrease in the blood pressure. So, the treatment should be to maintain the cardiac output and to maintain the arterial blood pressure. So normally if it is a compensatory stage, the body itself will try to do that. But as a doctor, you have to maintain the blood volume also and you have to maintain the blood pressure. So what we are going to do is first do the replacement therapy. So you try to bring back the blood volume towards normal. So the blood volume towards normal can be done by giving the whole blood, or you can use the plasma to transfuse blood on plasma. If it is not there, then you can use the dextran as plasma substitute. So you can have replacement therapy. Now to maintain the blood volume and to maintain the cardiac output. The second line of treatment will be sympathomimetic drugs. Now, these sympathomimetic drugs will cause the sympathetic stimulation to increase the vasoconstriction, and thus they will increase the arterial blood pressure. But now you can see that this particular treatment will be useful only in cases of neurogenic and anaphylactic shock more commonly, because the other types of shocks it will not be useful as the body itself has tried more amount of sympathomagnetic stimulation. So that is it. Then the third is head down position. The second is oxygen therapy. This again is a doubtful type of treatment because oxygen itself, the blood flow itself is hampered. So even if you are going to give the oxygen, how far it is useful, it's not known. Then you can give the glucocorticoids, which increases the pumping ability of the heart and thus it helps in the treatment of the shock condition. So this is a physiological basis. The goals of the treatment will be you finally try to maintain the A, B, C, D, and E whenever a patient comes to you in a condition of shock. A is maintenance of airway, B is control of breathing, C is control of circulation, D is oxygen delivery should be maintained, and E is endpoints of resuscitation should be thought over. So these are the goals of treatment. You always have to try it in this manner. A, B, C, D, E. Whenever a patient comes to you. Now, this is all regarding your discussion of the circulatory shock. We'll have a two-slide discussion. That is, try to diagnose that type of shock. An 81-year resident of a nursing home presents to the emergency department with altered mental status. She is febrile, temperature is high. She is having low BP with a widened pulse pressure. She is tachycardic with power stability. So definitely that condition is shock. What type of shock it is? It is septic shock. Why? Because you are having high fever here. So these are the things which you have to remember. So this is the cause, this is the condition, the organism, the bacterial condition will cause first one organ will be affected. and that's will be released and causing the multiple organ failure and leading to septic type of shock. Then here comes one condition where the 34-year female presents in the emergency room after dining at a restaurant where shortly after eating the first few bites of a meal become anxious, diaphoretic, began wheezing, noted diffuse pruritic rash, nausea, and a sensation of her throat closing off. She is currently hypotensive, tachycardia, and ear hearing. So is it shock? Yes. What type of shock? Anaphylactic. Why? Because you can see there is a wheezing, there is a pruritic rash, there is nausea, and throat closing off. These are the reactions which are given by histamine and histamine-like reactions. So generally this is anaphylactic type of shock. I think that is all regarding the discussion of shock. If any questions are there, you are free to ask the questions. Thank you.